let's go ahead without further ado. Good morning, good afternoon, everybody. This is Lina Abou Habib from the Asfari Institute for Civil Society and Citizenship at the American University of Beirut. I'm very, very, very happy to have you with us. I'm actually starstruck a little bit. This is an unusually amazing panel with three wonderful women who are all stars in their sectors, icons, feminists who are also trailblazers. So it's a major thing to have you with us. So thank you all for being with us. This webinar is entitled Feminist Perspectives on Work and Care in Pandemic Times. And it was organized, conceptualized, put together by our newly appointed senior fellow, Dr. Maitrayee Mukhopadhyay, also my wonderful feminist mentor and the mentor of many. I think many of us feminists of different ages are where we are because of Maitrayee and how she shared her knowledge with us, and how she made sure that we learned from all of our mistakes. So thank you, Maitrayee, and thank you for joining us. I'm very happy to welcome the students of the Professional Gender and Development Training Program of our partners, the Royal Tropical Institute. This webinar was organized by Maitrayee as part of their program, and I know that they are with us now or are starting to join us. And also hello to everybody who's joining us from the AUB community and beyond. I'm going to hand over to Maitrayee, who is the chair and moderator of this event, and she in turn will present our amazing guests. Maitrayee, over to you. You're muted now, Maitrayee. Now you are muted.
Unmute. Okay. Hello, everybody, yet again. Can you hear me?
Yep.
Okay. Thanks, Lina. I'd like to welcome our speakers, Dr. Naila Kabeer, Joshua Dasgupta, and of course, Lina Abou Habib herself. I would like to take a few minutes, though, to introduce the speakers beyond this illustrious CVs. And I would also like to say something about the theme. All right, first, Dr. Kabeer needs no introduction, especially for those who have studied in our KIT course on gender and development and are present here. We're still using her foundational work, Reversed Realities, to introduce gender and development to our students. We know through her work that Dr. Kabeer is an outstanding scholar and economist whose social analysis has given meaning to the term feminist economist. Her scholarship on work, livelihoods, and poverty, among others, and I stress the others, has helped build a body of knowledge which both her students and those working in development have greatly benefited. For me, the friendship with Naila over 3 decades has been both an intellectual and personal one, from which I have benefited immensely. She introduced me to the theoretical underpinnings of gender and development and how to conceptualize agency among many other conceptual issues. Dr. Kabeer will reflect in her presentation on the policy and real-life trade-off between lives and livelihoods posed by measures taken to contain the pandemic. And the personal part, I do later another time. Joshua Dasgupta needs no introduction among feminist activists in India, but for this audience, I would like to say a few words, although it may not do her life and work justice. Joshua has been in women's health activism for almost 3 decades, worked on transgender issues in the last decades, has worked both at grassroots level and as well policy, has represented civil society organizations on government committees, written and published on related issues both nationally and internationally, and has led feminist NGOs and the National Foundation of India. I'm privileged to be working with her on the Ideas Research Project Countering Backlash. Joshua will talk about the predicament of female community-based frontline health and childcare workers on whose voluntary labor the under-resourced public health system in India relies. Lina is today known to all of you at AUB as the director of the Asfari Institute, but her knowledge and activism on civil society has developed over 3 decades of personal involvement. Her introduction to feminism dates back to the preparation conferences for the first World Conference on Women in Beijing, 1995, during which and after she networked with and built a movement regionally on feminist critique of religious family laws. Her CV details her work, so you can have a look at it. But for me, her beginnings in the 1990s, when I took her kicking and screaming to the preparatory conference for Beijing held in Amman, and after which she took off, epitomizes the struggles to emerge as a feminist in a not so conducive environment. Lina will throw light on the care crisis in Lebanon and the region in the context of conflict and economic collapse. Now, a few words about the subject. This seminar, Feminist Perspectives on Care, Work and Care in Pandemic Times, is of special significance. It's not that there has been none. In fact, we see a growing body of research and knowledge on the present crisis of care in the pandemic. There is now a well-developed feminist critique, but we are still learning. The significance of today is that it brings together the 2 worlds of academic analysis and activist engagement with these issues in each of the presentations of our speakers. Because to be a feminist is to take seriously that knowledge is a terrain of struggle. It also brings together the themes that the Asfari Institute represents: scholarship and activism on citizenship and civil society. I would like to make some overall points at the start. What the pandemic has really exposed is that the crisis of social, political, economic dimensions is not of today's making. It's not a result of the pandemic, but it has evolved over decades of financial austerity and neoliberal policies in pursuance of a development paradigm that has only served to enrich the rich and impoverish the poor and damage the environment. From a feminist perspective, the systematic undermining of public provisioning of care has deepened the crisis, which under lockdown conditions simply reinforced private provisioning in the domestic arena, most of it borne by women. But this too is a form of generalization that is partial and built on the partitioning of private and domestic. Because for most poor women in this world, their work in livelihoods and in care, their work in production and social reproduction are continuous and most often cannot be separated into the public and domestic. In a recently concluded study by Quartalin Contractor, of which our students from the KIT students will be familiar with, entitled Mapping Wetland Practices, she looks at collective action from women from fisher communities to campaign for protection of coastal wetlands to the north of Chennai in India. It documents perspectives and everyday practices of fisher women that support life of indigenous wetland communities. They perform myriad tasks that are crucial to artisanal fishing economy, but their labor remains invisible. According to the author, at first she tried to separate out the care work that they do for families to sustain life with that from the livelihoods, but found that in women's accounts and daily activities, this distinction disappeared, including the physical separation of the 2 worlds. Furthermore, because one group of women fishers actually fished with their hands in the wetlands, which is a laborious work that requires a great deal of care, it's a form of care practice that is extremely environmentally friendly. But imbricated in this care practice is the intersections of caste and gender, because low caste women were not permitted to use tools and technology for fishing. And yet this makes it a quintessential care practice. Another aspect of the care discussion is what has been happening in the world of work and employment. What What when growth employment area for women is, as it has become, the commodification of those care practices? That is, I'm referring, for example, to the international migration of women into domestic care for wealthy or middle-class families in the Middle East region and the West, where women perform the same tasks they would in their own homes as carers for children, cooks and cleaners, and care of the elderly. Here in Beirut, you are fully acquainted with such workers, many of whom, for example, the Ethiopian women, were put on the streets as the economy collapsed and the lockdowns shut everything down. McDowell shows that in the UK today, care services is a growth industry and a big employer of women. As elsewhere, here too, the intersections of gender with race and class produce an army of low-paid, without prospects workforce. What when care work attached to women is seen as a service to the community, as Joshua illustrates in her presentation? The concept production and social reproduction are core concepts, especially for feminists in development. From this understanding, arises the understanding that capitalism needs the care work of women in the family. The fact is, capitalism still needs care work to subsidize it, but not just of women in the family, but of a racialized, sexualized workforce. They, along with their garment worker counterparts, who are mainly women from developing countries in the most globalized of industries, keep us clothed, our homes cleaned, and children taken care of. Is it time for a re-theorization of production and social reproduction? On that note, I'm going to invite Dr. Naila Kabeer to begin.
Okay. I'm not on mute. No. Okay.
No.
Hello, everyone. Let me start by sharing my screen. And going to the beginning. So this is something that I've been working on over the course of the pandemic, because clearly there are many different ways in which we have experienced the pandemic, all of us in different parts of the world. But there are also certain commonalities that cut across countries. And it's some of those commonalities that cut across countries, but also the differences within countries that I'd like to talk about. So let me start by the question, by the kind of claim that was made at the very beginning. We had Boris Johnson talking about Team Britain. We had Rishi Sunak, who is the Chancellor of the Exchequer in Britain, saying, you have not been forgotten. We will not leave you behind. We are all in this together. And even Madonna was posted that we're all in the same boat. If the ship goes down, we all go down together. What is wonderful about this pandemic, it has made us equal in so many ways. But very soon into the pandemic, it became clear that we were not very equal in so many different ways. That some of us were certainly, experiencing the pandemic in much harsher ways than others. And one of the other things that came up, and Maitrayee talked about, the pandemic didn't create inequalities, but it certainly built on them and it widened them. And so Antonio Guterres, the Secretary General of the UN, said it was like an X-ray that revealed the fractures in the fragile skeleton of the societies that we all occupy. And Joe Stiglitz says it has laid bare deep divisions. But it's not too late to change course. I hope that is true. So this was a variation of cartoons that came out again and again. We may be in the same storm, but we are certainly not in the same boat. You know, some of us are on these great big yachts, some of us in smaller boats, and some of us are just clinging on by our fingers to whatever debris is passing by. So who are these people in these different boats? Of course, it's the inequalities that we're familiar with. And one of the most pervasive is gender. We may talk about intersectionality, we may talk about all these other things, but gender cuts across all societies in some form or other. And it cuts within society. So it differentiates people within societies. And if we look at the top richest men in the world, we see how intersections come together. As you can see, the top richest men in the world, 10 richest men, people in the world are all men. And 7 of them live in the US. And that in itself tells you about the way class and gender operate, how they come together, how privileges of wealth also privilege one gender over others. If I were to give you the equivalent for the 10 richest women in the world, which I have somewhere, you would find that the 10 richest women are actually not all concentrated geographically in the way that men are. I'm not quite sure why, but they are spread out in different parts of the world. However, what you will also see is the richest of the 10 richest women is much poorer than the poorest of the 10 richest men. So women as independent holders of wealth are still poorer, even at the very top 1% or whatever we're talking about. The rest of us, and of course that lot, the 10 richest men and women, don't appear in what I'm going to show you, which is my very simple diagram of what labor markets look like across the world. And across the world, they are hierarchical. And at the top, I mean, our richest men and women are not there because they're not in the labor market. They're in the market for capital. They rely on the labor of others. But at the very top, of course, are people who are fortunate enough to be in formal jobs with protection and unemployment insurance and pensions and so on. And then below them are the people who are in the informal economy, and most of us in the global south, that is the dominant form of work. No, very little regulation, very little protection, but still engaged in market activities. Then there are those who are engaged in production for own consumption, what we call subsistence activities. And these will be things like, cultivating crops for your own family or rearing cows for their milk for your children and so on. This doesn't enter into the market. But at the very bottom is, of course, a whole set of activities that don't enter into the labor market at all. And that is the unpaid care work that largely women do across the world. But if we look at this pyramid, and those little arrows are telling us that as we go down the pyramid, the more precarious and poorly paid and unreliable are the livelihoods. And similarly, when we go down the pyramid, they are much less likely to be, we are less likely to find the privileged races, ethnicities, etc., and genders of the world. We are likely to find many more women and many more socially marginalized groups. And of course, there are women at the intersection of these socially marginalized groups who are almost always far more disadvantaged than men from these groups. And in the uncounted unpaid work, we find largely women, but there may be women from different classes. However, as we know, more privileged women are now able to outsource a lot of their unpaid domestic work to paid workers, to domestic workers, who may be from their own country, from those at the social bottom of the hierarchy, or they may be migrant workers coming in from elsewhere. And the question, of course, that we've always asked, and I want to revisit it now, is why is unpaid care work not counted as productive work? And why is it excluded from the labor market? Well, there are 3 reasons that were given in 1993 when the ILO statisticians decided to count subsistence production of goods, but not the provision of care. So the reason that they included, own cultivation and, if you were rearing livestock for its milk, etc., that counted as productive work, even if it did not enter the labor the market, but not the services that you provide. And the reasons for this, they said, is that if you included all the unpaid care services that women were providing within the home, then most of the women would be employed most of the time. And it would, confound our labor market statistics because you wouldn't be able to map, booms and recessions and so on. So, okay, fair enough. But we could collect that information separately through satellite accounts, time use studies, and that would still give us some idea of the amount of time that's going into unpaid care. But some countries do it, most countries don't. The second reason was that Services are consumed immediately by the person that they are given to. So when you put a child to bed, that's it, the child is gone to bed. Unlike when you produce milk, that milk has a presence in the world for a while, which theoretically you could sell in the labor market. But when you look after an elderly person, when you cook a meal, so on, that gets consumed. And therefore, it's very difficult to decide, what kind of price it would command in the economy. Well, feminists have countered this by the idea of the third person principle. And what they say is that, yes, certain things that are self-reproduction cannot be outsourced, right? No one can sleep for you. No one can watch television for you. No one can do sports for you. I wish they could, but you have to do it yourself. But there are many other aspects of what we do at home that can be outsourced. Cooking can be outsourced. Looking after an elderly person can be outsourced, and it often is. So it is nonsensical to say that these are difficult to price. Of course, the prices they command reflect the very low value given to this work. So people in the world who are involved in domestic work are very often women from poorer households, who are paid a pittance for the work that they do. But they are still, there is still a market price to it. So it is erroneous to say that services cannot be outsourced. The final reason was that the owner-current provision of services for the family is not done in response to market signals, right? It is done out of love, out of altruism, out of duty, obligation. And therefore, the logic that governs it is not the same as the logic of the market. So it is not going to be responsive to market signals. And so it has very little effect on the larger economy, limited repercussions on the larger economy, to which, of course, feminists have said, well, first of all, they are producing the labor that goes into the larger economy on a daily basis. Secondly, we see how unpaid work comes into its own in times of crisis. You cut social services, you cut public spending. Who picks up the slack? It is this unpaid economy, right? And thirdly, I mean, there are many other ways, and we now know that a lot of economists are buying into the idea that because unpaid care work is preventing women from going into the labor market or positioning them very unequally in the labor market, this is bad for growth. There's the McKinsey report and the World Bank, etc., saying that we need gender equality in the labor market, all across the labor market, for higher rates of growth. And if unpaid care work is preventing women from participating in that growth process, then it's certainly having repercussions on the rest of the economy. And now, of course, we will see what happens in the current crisis. So these are the things that, these are the arguments that, so what I want to go on to is what COVID has presented, a real dilemma, because it is unlike any other crisis, any financial crisis or structural adjustment or natural crisis. Here is a crisis where, in order to preserve our lives and our health, we need to stop working. So policymakers have been confronted with the dilemma. How do you trade off public safety and reviving the economy? How do you trade off life and health and livelihoods which keep the growth going? And this has brought into the labor market a further distinction. We've had the formal and the informal, we've had paid and unpaid, we've had casual and full-time and so on. But it's brought into the labor market the distinction between essential and non-essential work. And what is very interesting that Sarah Stevano and her colleagues have done, I found it a very useful paper, is they have looked at about 7 or 8 different countries and tried to work out what is being defined as essential work. And what is very interesting is that apart from about 13 or 14 or 15 out of a total of 51 different essential activities, only these 13 or 15 are in common. I can't remember the number, it may have been 21. But out of a fairly large number of services, which one country or another has decided essential, they only share a common subset. So there's a lot of politics that has gone on into deciding what is essential and what is not essential. And nowhere is this politics more glaring the injustice of this politics than India, where construction work has been, shut down everywhere, except for the Prime Minister's vanity project, which is the renovation of the parliament buildings in Delhi. These have been classified, the work on it has been classified as essential, even though it's costing, I think, £2 billion. And the workers are not getting the full protection, but they are classified as essential workers. And we all recall the terrible scenes in India during the second lockdown. So all that money that could have been spent on, creating hospital beds, creating health services, etc., went to building Prime Minister Modi's vanity project. Okay. When we look at this distinction between essential and non-essential, it starts to divide up the labor market in a number of different ways. First of all, there are those who are above this trade-off. Do lives and livelihoods matter to Bezos and Musk and all these other people? No. They continue to live in their fancy apartments, their palaces, go to their islands, and they get richer. So what we have seen is that these guys have systematically got richer over the course of the pandemic, while the rest of us, many of us, have become poorer. And of course, what they do for entertainment is they're racing each other into space. So we are all homebound, stuck in our homes, and some of our homes are tiny little spaces, but these guys are off into space. So let's put the 1% aside. This trade-off between lives and livelihoods doesn't matter for them. Then we have the essential workers who have to keep on working. Their lives are being put into jeopardy in order to protect our lives and our health. And among the essential workers, we can distinguish between those who receive some protection from the virus and those who don't. So those essential workers on Modi's vanity project did not receive, as far as I know, very much protection. Then there are non-essential workers. So those are the essential workers. Non-essential workers who can keep on working at home and who don't, their income streams remain. So they protect their lives, but their livelihoods are untouched. Then there are formal non-essential workers who have had to suspend work, but continue to draw their salaries. So a lot of people who work for government, who work for large corporations, stayed at home. In Britain, a lot of them were able to pay their workers money because of the government's furlough plan, by which the government paid part of their the wage bill. But then there are non-essential workers who become unemployed. They've had to suspend work, but they have some access to social protection, some kind of safety net. But finally, at the very bottom are non-essential workers who have been laid off, who cannot continue work, and who have no safety nets. And these are the people also for whom the livelihood trade-off takes a particular appearance. So when we go to the essential workers, I want to look at Britain and the fact that the first 10 people who died as part of essential work were all Muslim migrants. A lot of them were men. And as we went on in the pandemic, we find that a disproportionate share of these essential workers, health workers, doctors, nurses, porters, volunteers, were from racial and ethnic minorities. And that tells you a little bit about things like about their lives, the kind of conditions they lived in, whether they suffered from comorbidities, and whether they were being protected while they went around doing their essential work. And that story, of course, has been repeated across the world. And the story is also about who got protected and who didn't. Why was it these ethnic minority doctors that died? Because the privileged white doctors were the top consultants. They stayed in their offices. They gave orders. These are the ones that did the hospital rounds, that came face to face with the virus, and they were not given protection. And here is one of the startling images from Britain, that there was so little thought about protecting them, that a lot of nurses were wearing bin liners at the beginning of the pandemic. And of course, in India, we know that the health workers who are lower down, women who are lower down in the medical hierarchy, also got far less protective gear. But, we clapped for them. Every Thursday in Britain, we all came out and we clapped for them. But we didn't give them protective gear. So a lot of their lives were lost. And we didn't give them a pay rise. They were offered a 1% pay rise in March 2021 after all that clapping. And this poster says, just look them in the eye and say they're worth only £3.50 a month extra, and that is pathetic. And that is the kind of government we have. Good on symbolic gestures, lousy on concrete recognition. So let's turn to the non-essential workers. And I think Joshidhara will be talking about some of the essential workers, many of them women in India. Amongst the non-essential workers, according to a study by the World Bank, about 30% of North Americans and Europeans could continue working from home, compared to just 6 or 7% in Africa and Asia. But when they talk about working from home, who could work from home, they're talking about access to the internet and computer services and all. So they're talking about a particular kind of teleworking, which is not available to kinds of women who do home-based piecework, in third world countries. So these home-based workers were these people who worked from home had access to the latest technology. I had access to the top technology, so I could continue lecturing, doing office hours and so on. But many people couldn't. So these people's salaries continued. Then there were those who were informal, couldn't keep on working, but they got some kind of safety net. So countries like Brazil and Colombia adopted emergency financial aid, which day laborers could apply for, but it was so complicated and you needed access to the internet that only a small proportion of day laborers managed to get that protection. I know in India, there was the public distribution system and others, but these only apply to people within a particular state. They don't apply to people who are migrants from another state. And then, of course, we have those non-essential workers who had to be laid off, who had to stop working and had no safety net. And according to the ILO in 2017, over half of the world's working population has no such safety net or social protection. And of course, these are the people at the bottom of the pyramid. Most of these people are street vendors, construction workers, home-based piece workers, domestic workers, and so on. And the most startling and the most lasting image for me will be a group of these non-essential workers with no safety nets, the internal migrants of India. There was a drop of about 112 million workers in India, and many of them were small traders and wage laborers. They were made jobless overnight because the Indian lockdown, I think, gave people a notice of, 4 hours or something ridiculous like that. After which everything shut down, shops shut down, transport shut down. So all these people who came from the lowest caste, poorest states, etc., were left stranded in the city and had to find a way to go home. And many of them walked many, many miles, many hundreds of miles, and many of them died along the way. So this is the image that one of the cartoons I have, the author at the end, last slide, of these thousands of people trying to get home while the middle classes stood and clapped for the essential workers. But these were not the essential workers. They were not non-essential. And here we have the images of these women with all their belongings on their heads, trying to find their way home. And I think that has been, for me, one of the most telling images of a government that does not know its people and does not care about its people. But what the pandemic did, if we look at all these different groups of workers, all in these different boats, some in the yachts and some clinging on to the debris, we can see how the fault lines of the pandemic imitated or mirrored these pre-existing inequalities. So women lost their jobs in much larger numbers. They were represented in the hardest hit sectors, food services and arts, entertainment, hospitality, and so on. And of course, women are in the front line of health workers. So many of the people who died were women in the health services. We know that women tended to lose their jobs, but also lesser working hours. And we know that migrant workers suffered a great deal because they were non-essential workers without any kind of support. And when we zoom in closer, we begin to see how the intersectional nature of the inequalities that characterize losses and tragedies over the pandemic. So unemployment rates for women exceeded those of men in the US. They started out higher for Black people and Hispanics, and the biggest losses came for Black women in the US who were in these low-paid, non-essential jobs. In South Africa, you saw, the fault lines, both men and women lost jobs, but larger declines for women. And the fault lines showed that the jobs were larger for African populations than non-African, for educated people, for uneducated people compared to educated, for poorer people compared to richer people. And within each category, women lost out much to a greater extent than men. So these pre-existing inequalities also determined how the pandemic played out in terms of lives and livelihoods for different groups of workers. And in all of this, we talk about the essential work of care, but we have to make a distinction between essential work and dispensable workers. Because what the pandemic has taught us is that in some places, domestic workers were kept on, right? But in most places, and certainly Bangladesh and India, domestic workers, reported for duty. Many of them don't live in, they work for multiple employers, a few hours here, a few hours there. Reported for duty, but the employer said, nope, no more work until we tell you. So domestic workers were laid off in large numbers. And those who were kept on living with their employers weren't looked after properly. And I think Brazil reported that one of the first confirmed deaths by COVID was a domestic worker, a 63-year-old diabetic Black woman who was working in an upper class household in Rio de Janeiro. Her employer came back from, perhaps it was Italy, I can't remember, infected her. She had to be taken home. She died. The employer survived. And because of these increasing controls, irregular domestic workers, irregular migrants, really suffered from the same kind of stranded condition that we saw in the internal migrants, amongst the internal migrants. And then, of course, what we don't see because they're not a part of the labor force are, and I really like this image, it's telling you about this essential worker, the policeman, having his lone meal, doing his duty, all this for us, stay at home. But it's not telling you about the person who cooked that meal. It's not telling you about that invisible, and she is literally invisible in this picture, who is keeping his home going. When he comes home, he has to wash himself and she has to make sure that everything is sanitized. So that to me is an image that says a lot, that all this for us is being done by the policeman, but all this for us is not being applied to the woman at home. And so what we all know is that unpaid care work went up by a huge amount across the world. We know that men did a much larger share of the work, but both men and women, men apparently tend to overestimate how much work they did, and women may underestimate how much work the men did, but both men and women agree that it was the women in the home that took up the biggest share of the increased work burdens associated with everybody staying at home, children not going to school, having to be taught, things having to be kept clean, and so on. But along with the work burdens, of course, is the shadow pandemic, the well-being fallout of the pandemic and of having to stay at home. We know that there has been a rise in domestic violence across the world, but we also less frequently reported are the tensions that people suffer of trying to look after the family, get them fed and so on when school is not continuing. The ill health, the toll on people's health, and various other kinds of scattered examples of, children being married, girls being married off early, some way of perhaps reducing the burden at home. So along with the more widely reported work burden, the increase in work burdens and the unequal increase in work burdens, there are all these other well-being, depression and tensions and stress. And those of us who are more privileged, have more room to walk around and be around, can only imagine what it's like to be cooped up, often with an abuser in this very small space. So the pandemic has taught us a number of lessons, and whether these lessons will be taken to heart is another matter. Maitrayee, how much longer have I have? You're on mute.
About 5-6 minutes.
5 or 6, that's fine. So yeah, there are lessons, and as Stiglitz says, it's not too late. But I don't know, and I hope somebody in the audience can give me reason to be more cheerful. you know, when, if we call them filthy rich people get even filthier rich, and when very poor people get even poorer, we really have to work out how this system is going to be changed, that it doesn't reward effort so unevenly, so unequally, and so unjustly. And one of the things, of course, we haven't learned from past crises. So when we look back at the structural adjustment era, one of the concepts that came out during structural adjustment was the idea of vulnerability. Because at that time, we had this whole the newly poor, you know, people in the public sector who had expected steady lives, steady jobs, were being laid off. So anyone could be hit by crisis. Vulnerability referred to the fact that it wasn't just the poor who became poorer. It could be stable, you know, people in stable jobs. And you would have thought that vulnerability, because it could affect so many different classes of people, would have made a strong argument for a much more universal approach to protecting people, but it didn't. The World Bank insisted on residual safety nets, left the market, you know, throw up insurance schemes, etc. The Asian financial crisis taught us that it's not a good idea to start putting social protection measures into place after a crisis. You don't do it very well. They should be institutionalized. They should be ex ante rather than ex post, so that when the crisis comes, you're ready. Well, that didn't happen either. A number of East Asian countries did take the lesson to heart, and they did start to establish much more institutionalized forms of crisis. But in the rest of the world, it was continued to be targeted and ad hoc. The global financial crisis, you know, do we go for stimulus or do we go for austerity? Well, in Britain, we went for austerity. So we use all the public funds to bail out the banks that had created the financial crisis, and we blame the public sector. Oh, all these public sector people, they earn too much, they have generous pensions, they're the ones that are draining the country of its wealth. So they opted for austerity measures, they cut back on police services, and we saw a rise in domestic violence, cut back on welfare, cut back on, and they started to privatize the National Health Service. So that by the time the pandemic came, we have a far more skeletal National Health Service, you know, with a lot of internal markets and internal privatization that we don't get to see. And of course, we offer the nurses £3.50 a week extra, while the MPs continue to pay themselves very handsomely. And so these are the costs of the lessons not learned, that every time there is a crisis, there is this fallout which hits the majority of the world's poor hardest. And the IMF has said we're likely to emerge with even higher levels of inequality than we entered. And if left unchecked, and this is something the IMF and people don't like, it might lead to social unrest and long-lasting grievances. And I'm hoping that fear of social unrest is something that might lead these powerful institutions to take a stand. A second lesson is this whole business of unpaid care, that it has emerged as the essential work par excellence. Lots of other forms of work had to be suspended because they were labeled non-essential. Domestic work had to be suspended because it was labeled non-essential. But we now see a distinction between the work and the workers. So when domestic workers had to be suspended, the work didn't stop. That essential work continued, but it was now done on an unpaid basis. So, but the thing is that if we go back to that third party principle that most services can be outsourced, yes, most services were outsourced to these badly paid workers. But there is a distinction that feminists make between to care for people and to care about them. To care for people is put them to bed, cook their food, etc. To care about them brings in the element, the affective element, the emotional element, the thing that makes you do something without expecting a reward. And we don't really want to outsource. You cannot outsource that. You cannot expect a hired domestic laborer, however well they do their jobs, to love your children, your elderly, etc., in the way that a family member might. On the other hand, that unpaid essential work has to be voluntary. It should not be enforced. We talk about duties, but duties are often enforced. And I've been thinking about it a lot because of looking at Bangladesh and the way that older women talked about how little love they got from their mothers because their mothers had so many children. So it brings to mind that if you want essential work to be done with love, it has to be voluntary, and therefore you need reproductive rights. So I'd like to bring the whole issue of reproductive rights into the picture, because now we are having a threat to the right to abortion, which means there are a lot of mothers going to exist who did not want children, who did not want their children. And that is not good for the child or good for the mother. There is a study that tells us that women who were denied abortions end up 5 years later far poorer than they started out. 2 more points. One is that moving beyond unpaid care, there is a whole lot of other services that are done on an essential basis. You know, cleaners, garbage collectors, post people, and so on. And they have continued to work, but they are still amongst the lowest paid, still amongst the least respected. And there is no way in the kind of market economy, no matter how hard they work, there is no way that everyone is going to get the kind of merit that markets recognize. And so Michael Sandel, the philosopher, talks about contributive justice, that we have to provide these people who do this essential work for us on a daily basis with decent living and dignified livelihoods. And that means that means resources. It doesn't just mean clapping for them. It means providing them with the resources. And that, of course, brings the budget and, you know, revenue and expenditure right to the heart of a new social contract, because it will require us to tax those people at the top who earn far more than they can ever consume or ever need, and have some redistribution that your garbage collector, your domestic worker, all of these people have dignified livelihoods and have respect. And then, of course, I want to end with what we all want, a different kind of economy. And for me, a different kind of economy might put care at the heart of it, but it's actually about human capabilities, more broadly speaking. And it means from the time you're born that you should have what you need to survive and flourish in a healthy way. And that means investing in all the things that promote human capabilities: health, education, lifelong learning, emotional support. All of these things, I think, when we say that there's been a dip in growth, that growth has fallen is because we've all stopped working, right? The people who own capital continue with whatever they do, but it's labor and human beings that create growth. And yet they are not given any priority. With they are given the only priority they are given is what they can earn through the market. So I would like us to think about, go back to the idea of a global social floor, but building on a global social floor, a human-centered economy, a human-centered infrastructure. So I'd like to end there.
Thank you, Naila. We're going to go straight on to Yashodhara and keep the discussion for later. Yashodhara, can you please begin and try to keep it to 15 minutes? Or yeah.
Thank you. Can you see my screen?
Yes.
Okay, thank you. Thank you very much, Naila, for that brilliant kind of keynote setting the context for what I'd like to talk about, which is about the care extractivism in India. So just to give a little bit of context for all our international friends in this webinar, is that in India, the very crucial roles of the last mile delivery of healthcare and nutrition support, as well as looking after small children, is handled by community women cadres, among whom I will be referring to two. One of them is called the Accredited Social Health Activist, ASHA for short, and they have been working since 2005, and they are about 1 million as we speak. And they basically work with a certain number of households in their neighborhood as a kind of health volunteer to bridge the households with the formal health system. And just like to flag that they began with about 6 roles that they had to play, which over the last 15 years has increased to 43. And this is before the COVID-19 pandemic. The second cadre that I will be talking about are called the childcare and community nutrition workers, Anganwadi workers and their helpers, who have been working since 1975, and they're close to 3 million. And they basically run daycare centers for half the day for children who are 3 to 6 years old. They also provide supplementary nutrition for these children, carry out nutrition monitoring, and also look after pregnant and lactating women. So these are the two cadres who are sort of seen as working as part-time volunteers. So what happened during the COVID-19 pandemic? So in addition to all the other tasks that they're already responsible for, which includes the 43 that the ASHA workers had, and all the responsibilities around community nutrition and childcare that the Anganwadi workers had, the entire sort of frontline response to the pandemic, which was basically the primary data collection and surveillance, as well as management at the frontline, was given to these women. So they basically had to look house to see who had the infection, trace back to their contacts, send them for testing, check the migrants that Naila just spoke about, and kind of look at how quarantine centers were running, etc., ensure that there was food at the quarantine centers, ensure that households where people were isolating had some supplies, including for pregnant women and small children, the nutrition, etc. And the entire role of the documentation at the grassroots and then informing people about the pandemic, etc., was entirely being done by these women workers. And then, of course, after the vaccine program started, which was last January, they had to do the actual mobilization to get people to overcome reluctance and, the myths and fake news, etc., and to get them to attend the camps on time, etc., and often to accompany people who could not make it. So as a result of this, we saw last month that the World Health Assembly actually recognized these as one of the global health leaders and, kind of honored them, especially for the crucial role that they had shown throughout the COVID-19 pandemic. But yet, what exactly are the working conditions of these workers? So what we find is that they are not termed real workers. They're seen as part-time and as volunteers. So in this, for example, their wages are far less than what the government has mandated as the legal minimum wage for even unskilled workers. And so, for example, Anganwadi workers have a fixed wage, but the ASHA workers, they in some states of India have a part wage which is fixed, but the rest of it is basically incentives for these 43, now added on maybe more than 50 different mini and micro tasks that they perform. And interestingly, these incentives have remained static in the amount from 2005 until 2022, despite soaring rates of inflation in the country and several pay commissions that pay government officials humongous amounts of money. In terms of working conditions, of course, there is no contract and therefore there is no social security. They are not covered for healthcare. They do not receive maternity benefits. They are not entitled to any kind of paid leave. They do face a lot of harassment in the community. During COVID, they have actually faced violence because they were seen as people transmitting the infection, but there is no protection for any of this. And in the meanwhile, their workload continues to increase. And yet they are not provided any opportunities for future growth in their career in terms of, skilling them or having them, promoted and so on. So basically what we are seeing is that although the state has employed these women, but the state keeps them in a kind of informal working arrangement over years and years and years, and thereby erases its own human rights obligations around fair wages and social security. So as you can see, women are not taking this lying down, and women have been protesting across the country in thousands. So I would just like to propose here a feminist political economy analysis in which we realize that basically there is a completely under-resourced public health system in the country, and these women are being used as the shock absorbers. So for example, over decades, there has been systematic disinvestment, and this short-sighted outlook has basically relied on the private sector to make up what the public sector is failing to provide. And this also, as Naila and earlier Maitrayee pointed out, banks heavily on the last mile role being played by women, which is as the unpaid roles as well as the underpaid care work, which fills the gaps. And of course, as Naila has pointed out, the pandemic clearly showed the skeleton, the flaws of this model, in which we had women juggling burdens of both sides of their work if they were in the essential work. And then we have the very, very poor distribution of health workers in the peripheral areas of the country, because the public health system has been completely under-resourced and does not have health workers of any skill level available. So then, who is marshaled for the crucial task, the community level surveillance, public health awareness, mobilization for vaccines, etc.? It is the least trained and the most vulnerable. And here, as Naila reminded us, these were the people who were at the front lines and yet received the least amount of personal protective equipment. So how does this show the women? It shows the women, they can be assumed to be these self-sacrificing caregivers. So basically, the whole way in which paid and unpaid labor is distributed, it shows how the gender norms will insist women turn up to be altruistic, and at the same time as they are performing these so-called volunteer roles, this also prevents them to be in any formal, well-paid full-time economic activity. And this actually is a kind of effortless segue from the unpaid household care work into community volunteerism, which actually shows this stereotype of seva, which is the Hindi word about caring for others, serving others, and women's economic role is seen as ideal for becoming worker volunteers. So what we do see is that the way the whole pandemic response happened was actually driven by gender norms, which are completely upheld within structures, institutions, and policy frameworks, just in the way households and communities were distributing roles. So I use the term care extractivism that Maitrayee has shown in her paper in 2020, where she links the fact that this context of deepening privatization and the neoliberalization leads to the care economy relying completely on the lowest end and is an intensified commodification and exploitation of this social reproduction labor. And this actually manages even crisis situations, but does not create any additional burden for either the state or the health industry, or create any further responsibilities for them. So as you can see, this was not taken lying down. And these women workers have been struggling and protesting, not just during the pandemic years, even as they worked, but even before that, for several years, they have been struggling for even their basic entitlements, for living wages, and for decent working conditions. And this has gone on for years, and yet we find that there is a continued refusal to pay attention to their demands. And this is kind of like an assumption that why are female workers being political? I mean, they need to be always submissive and apolitical in the kind of work that they do. But what is actually happening at the macroeconomic level is that we see that this assumption about women is leading to decreasing participation of women in the paid workforce in India. And also the fact that women's economic activity is clustered in that precarious bottom layer that Naila talked about, which is the informal, the non-essential, and therefore the unrecognized. And this gendered use of women's labor is happening in tandem with the erosion of the public health system, and as I mentioned, the diversion of public resources. So it shows how the complicity of the market forces and economic arrangements comes together with state policy and how household and communities maintain the structural determinants of health. So how do we create a more caring society? I completely concur with Naila that we need a total rehauling of our macroeconomic frameworks. We have to reinvest in the public systems for care, health, and nutrition. And we have to stop looking at these underpaid care jobs as a kind of extension of women's nurturing role within households. we could actually have better economic growth if we could enable this highly skilled female workforce to enter into decent service sector jobs and actually ensure that other women's time is freed up by, for instance, expanding these further into childcare services for infants, and therefore other women therefore are able to enter into more optimal economic roles. So in a sense, we can create a more caring economy while at the same time ensuring job creation for women. But of course, in the immediate term, I think we do want that the rights of women in these care jobs must be recognized. And that would mean giving them access to social protection measures and decent wages, health benefits, and so on, ensuring that they have formal contracts and that they have a growth trajectory in their profession, and the fact that there is safety, there's freedom from harassment, and there is institutional support for grievance redressal. And finally, I think we do call strongly for their right to organize and to be represented and to demand accountability. So I'd just like to end with an acknowledgement. What I just presented is really part of a chapter in the book, Political Economy of Post-COVID Life and Work in the Global South, Pandemic and Precarity, in which I have co-authored with Kanika Jha-Kingra, a chapter on the women workers at the forefront of COVID-19. And I gratefully acknowledge her contributions, that of my colleagues in the Feminist Policy Collective, as well as the Frontline Worker Solidarity Campaign, and also the inspiring struggle of these women working at the front lines. Thank you very much.
Thank you, Joshua. We should go quickly on to Lina. Yes. You are muted.
Okay.
Yeah.
I have to say it happens every time. Thank you so much. It's such a joy to listen to Naila and to Jashodhara and you, Maitrayee. And I want to begin, I'm going to make just a few comments in relation to MENA, to the MENA region, but more specifically to Lebanon, with the multiple layers of complexities and how it links to care. But I want to go back in time and to reflect on, the issue of care, as central as it is to feminist activism, has been, is very recent in the narrative, in the mobilization, in the, and also in the research questions in this region. It's very new, it's very recent, it's a realization that has come a little bit too late. I'm not going to dwell on the why and on the process, but I have to say that this explains why there's a very small, I would say, emerging body of literature on care in the MENA region and particularly in Lebanon. Having said this, I want to recall one of the very first conversations on care. The first of which, at least for me, involves also a conversation with Maitrayee, and it was back in the day when the region, particularly a country like Egypt, was taken over by structural adjustment programs. I think they call them something else nowadays, given their really bad reputation. But I recall very well, Maitrayee summarizing structural adjustment in Egypt and saying, at the end of the day, there's a cut down in investment on health. People have less time to spend in a hospital, less time to be cared for. The burden is falling on women at home. There's a cut down on education, investment in education. You have these huge classes with 60, 70 kids. Nobody learns anything. The burden goes to the mothers at home. There's a cut down in jobs in the public sector, at least in our countries. Back in the day, the public sector employed many, many women, and these were the first to be laid off. It's not a problem. They're going to go do care work either at home, or they're going to go to be oppressed in the informal sector, because we know how oppressive the informal work sector is in our countries. So that crisis, although or the repercussions of the crisis of care in the region, is very old. but the feminist activism around it is much newer. Then, a bit, down the line, another unfortunate conversation I recall at the Economic and Social Commission for Western Asia, ESQA, where two feminists were trying to make a point about what is wrong with our statistics and how care is completely invisibilized. And I remember these big wigs, the UN big wigs, the big economists, the big blokes, etc., fighting viciously in terms of how irrelevant even the word care is in such a space. And that's something that is totally in the private domain. So having said this, we've come a long way, at least in the MENA region. However, and prior to all these, these consecutive crises, we are in a situation where gendered social norms that make the division of care labor the way it is, that puts the burden of care labor on a particular category, namely women and girls, these gender social norms in this region are actually codified. They're codified at two levels. They're codified at the level of religious family laws. The first example would be, for instance, in the case of divorce, and in the case of divorce, where the only the only contribution to the quote unquote family is basically in terms of money earned by the husband. All the, of course, obligatory, I would say, indefinite and non-ending care work done by women in the family is never taken into consideration. We do know, for instance, in a country like Morocco, that many women end up to be homeless after a marriage because the 40, 50, particularly older women, decades of their care work goes unaccounted, and they are basically by law defined as women who do not work and therefore have nothing to claim. Granted, some of this have changed so far. So on the one hand, religious family laws in this region make care work invisible, make it obligatory. There's no way to compensate it. There's no way to claim anything for years spent doing care work because you had to, because you're a woman or a girl. And then there's this urban myth, this fallacy that we do have civil laws. We actually do not have civil laws. We have civil laws that are very much inspired by religious laws. We have civil laws that are inspired by patriarchal norms, by by hierarchies which put men on the top, and they are inspired actually by the concept of the male income earner, the male head of household. For instance, one wouldn't think that something as straightforward as the National Social Security Fund, of course, it's bankrupt now with the economic crisis, but the National Social Security Fund considers women's work as complementary to men. It doesn't see women as possibly heads of household. Women work to help their husband. They are not women, they are not actually income earners in the same capacity as their husbands, which has an impact on the benefits that they can claim. There have been, and this is where it's interesting, there have been many reforms, but not in the fundamental of women being secondary income earners and not basically income earners like any others. So basically, you're in the situation where, and this perhaps hasn't changed much until now, where this convenient arrangement, it's very convenient, but not for everybody, but this convenient arrangement where a category of people is working for free for other people, okay, is actually has become through religious laws, through religious family laws, through civil laws, through public policies, this has become kind of on the one hand, an untouchable tradition, which defines you as a good or bad woman, a holy obligation and a sacred duty, which is fine if it wasn't actually reflected in public policies. And here I would just want to stop just to make a parenthesis, because I seem to be talking or emphasizing on women who are citizens? What about the non-citizens? And this is a region that, that is fraught with conflict. I don't think there was ever a period in time where there wasn't conflict somewhere. And as we speak, most of the countries around us are in active conflict. So you do have a situation of refugees on the one hand, which have no protection whatsoever, no legal protection whatsoever. Most of our countries have not ratified the UN Convention for the Protection of Refugees and Migrant Workers. So we basically can do any form of abuse and it's fine. There's no recourse for the refugee, but particularly for refugee women, because most often they are on their own, and most often the common traditional head of household is either fighting, died, disappeared, or all of the above. So here you are, where in a situation where women have a complicated burden of care, which is also about survival, because and at least in the case of Lebanon and for practitioners on the ground, they do talk about not anymore incidents, but a trend of what they call transactional sex, because there's actually no other way. So the abuse is beyond in any, the abuse is in a way expected, because this happens over and over again in all conflicts, but at the same time, it's never provided for. It's never made as a policy. It's never resourced. It's never prevented from happening. And of course, the other thing is migrant women, domestic workers. Again, in a region that abounds, and this has been a historical trend and a historical journey for migrant workers in Lebanon. And I have to say that there are two things. Migrant women, domestic workers who bear the burden of care work, probably for the whole of this region and for countries in general in this region. And this is where I want to go back to how policies and laws actually are crafted in a way that they penalize, undermine, and make care work even more vulnerable. And what I'm talking about in this region, which I know is a little bit special because it's worse than any other place, is the sponsorship system. And the sponsorship system is a system that keeps migrant women, domestic workers in a bondage relationship, in a relationship where they have no agency over anything, where the labor law, at least in the case of Lebanon, does not apply. There are no rules for how many hours you work. There are no rules for how many toilets you have to clean during the day. There are no rules if you're given something to eat or not, taken to the doctor or not. You're simply in a relationship of bondage. So I want us to basically think about all this complex situation, add to it conflict, add to it migrant workers, add to it refugees, add to it laws that are oppressive, discriminatory, and which make care an obligation and which make care invisible and not where actually women simply lose because they do care work. Not only do they have to do care work, but they actually lose not just the opportunities, but lose their lives, and as a result have no other life choices. So fast forward, at least, and I will end my comments here. Fast forward, Lebanon 2-3 years ago, an uprising, the beginning of an economic crisis, the pandemic, the world's third largest non-nuclear explosion in the world, a totally broken infrastructure and a totally broken system. That's what corruption does. The system doesn't work anymore. Plus everything that I migrants, refugees, etc. What
You have
happens?
1 minute.
Yes. I just want to say that, with a government that is irresponsible, with a government that is oblivious of how all these crises are affecting people, a government which is amongst the 1% that Naila is talking about, there was absolutely no recognition that one of the main areas that was destroyed during the blast was actually populated by migrant women workers. Another area was populated by sex workers. There was absolutely no thinking that these people, because of the ways we treat them and the laws that we have that bind them, that they would be the most affected, because we dump them in the poorest of places and we dump them in the most insalubre places. That this is what happens when you have a major crisis like this. I just want to end with just a couple of notes, and I think yes, there's an amplified oppression and an amplified violence. Yes, the burden of care has increased 100-fold. But at the same time, and I want really to end on a positive note, at the same time, there has been a remarkable emergence of an intersectional movements. There have been a remarkable new narrative, a very strong and very compelling narrative, which looks at justice for all people and rights for all people. And what I want to say is there have been a mobilization of carers in terms of migrant workers outside the classical frameworks of mobilization, basically the patriarchal, racist trade unions. And I think this is what we need to watch out for. And this is what we need to, just learn from, because I think, our different levels of oppressions, they're always there. The problems of care are, we're in a mode where we're basically learning more and more about it. But meanwhile, this mobilization is alive and kicking, and it's happening. And I think for all of us as feminists, the question is, what is our role in contributing to it at the community level, but also what are the research questions for us that would be helpful in amplifying this emerging movement. Thank you.
Thank you very much. I'm going to go straight on to allowing questions. What I suggest is, can you please, I'll give you 2 minutes to write question and answers, burning questions. And we really don't have very much time more. So please, in the next couple of minutes. And thank you very much to all the speakers.
Maitrayee, there's a question in the Q&A.
Yes, I know. I saw that, but it's a very India-specific question. Let me, yes. Can you unmute?
It's not actually an India-specific question.
Yes.
Around the world,
actually, I was going to just translate this into a very universal situation that we're all in now. Naila and Joshodhara, it says, this is from Lakshmi Lingam, and wondering how do we work for an alternative economic framework where care work is a center, where the state and governance in India and in many countries are going increasingly right-wing and fascist. Further, the distress has not translated into change in political leadership. It has reinforced it in the elections. That is the Indian elections. Okay. Naila, would you like to respond?
Well, none of us have the answers. We are all in a very impossible situation. We are stuck with a system of growth that, as I've said, is deeply, deeply unfair, and where political and economic power are becoming closer and closer, so that it's very hard to get your voice heard. I think all of us just have to do what we do best. So as an academic, I will continue to try and write in ways that reach out to people, as a council worker, but I think the main thing is to build up a kind of momentum at the local level. I think and there are people who will be trying to influence, the major agencies, etc. I'm not that good at that, but I think, talking to our students, doing what we do, but gearing it to developing a momentum for a new kind of economy. So I don't think I can give you any more definitive answer than that.
Thank you. Yashodhara, would you like to respond?
Yeah, so I'm actually not going to repeat what Naila has said to Lakshmi's question, but there was another question that Janavi had raised earlier, which was really trying to look at how we see in the proposed plan for macroeconomic policies when governments are saying they're becoming unable to support social protection expenditure, where will the finances for better response, for care, social protection, etc., come from? What is being proposed? And here I just want to flag something that Naila has already said, and which we in the Feminist Policy Collective are also promoting actively, and that there has to be a more redistributive form of taxation. There are unimaginable amounts of wealth being made even during this utter impoverization of so many of the people of our countries. And it is imperative that we look also at this as a source of revenue. The fact that we are always afraid to tax the richest sufficiently in order to generate the revenues. And I know that in India, given the number of billionaires that we have, this would be a completely feasible economic option. But I will let also Naila speak to this question. It's in the answered tabs in the question panel. Thank you.
No, I have nothing to add. I think we should.
Yeah, I think that's okay. Lina, did you want to address yourself to any of these questions in the answer tab, please? Okay, shall I read out some just as what people need?
Actually, can I just say one thing?
Yeah.
And that is, you know, when I talk about we should do what we do best, actually a part of what we want to see is that redistribution. So when Lakshmi is asking how do we make a bet, how do we build the case for redistribution in ways that make sense to ordinary people, rather than being seen as, taking away earned income. So I see all of this as a part of the same struggle. The struggle is to persuade people that we need redistribution. The struggle is to persuade people that we need a different kind of economy. And and that's a big, big task. So I think all of us try and do it from where we're positioned.
Okay.
Lina,
there's somebody who is asking specific to Lebanon, but I think that could be extended almost to anywhere. Justice is what people need. How can justice be achieved if the government itself is the reason for the corruption of the country? Take Lebanon, for example. We have the potential, the capabilities, but we fail in every second to actually improve, to do what. So what the resolutions? What is the resolution then?
Okay. First of all, very briefly, first of all, I do disagree. There are not many laws that are transformative. The regime has been very careful in terms of which laws they bring in. They're corrupt and they're smart at the same time. They're not idiots. So they have been extremely slick. Like they put in, we have a law on sexual harassment, but they basically cut it down to the extent that it's very difficult to use. But nevertheless, and this is where I depart with the person, women, every time, at least in the case of Lebanon, the law for protection on domestic violence and the sexual harassment law, as imperfect as they are, women have resorted to them. As difficult as they are in terms of making verdict stands, and despite the fact that we're still seeing men who killed their wives still living their lives legally, but women have gone and have pushed for this. So I think this is a fight that needs to remain active, because this is where the power of the regimes, the power of the dictators lies, in being able to fiddle around with the body of laws. On the other hand, religious laws remain a very important space for struggle and for feminist mobilization, because at the end of the day, and it's similar for migrant women domestic workers. If you have a law that says you're a slave, you're done basically. So you can't basically dismiss the power of the law and the need to reform it. That's on the one hand. On the other hand, I think, yes, I also depart from the defeatist view. Having been around since the war and until now, the narrative have changed completely. The new form, and this is where I will end, Maitrayee, the new forms of mobilizations are really, really, I wouldn't say threatening the regime, but are really causing discomfort to the regime, to the extent now that they cannot tolerate a tweet or a blog or something like that. And this is good because they become more oppressive, but this is also part of shaking the system. And of course, it has always been, it still is an uphill battle.
Thank you. I have to move rapidly along because Lina tells me that we have to close by Amsterdam's 3:30. That is in about 2 minutes time. Actually, I'm going to take 5. I just want to say, Jaya and Lakshmi, we've seen your questions and answers. It's they're very interesting. Lakshmi, I think you are particularly asking, depends on which kind of universities you're talking about, whether or not the feminist critique is included. As far as I know, most universities don't deal with economics in a way that brings in the feminist critique, but Naila would know more. Jaya asks Naila, actually I think it's a comment, and that the historic defeat of women and they losing their control over their productive and reproductive labor itself was structural violence, making it probably the great-great-grandmother of pandemic. So in short, I would like to bring everybody together to...
Ishita had a question.
Yeah?
Ishita had a question.
Yes, I would like to read out Ishita's question, but we cannot actually address it. How do you foresee to combat depoliticization of unpaid care work, which is expanding in the context of the crisis of capitalism? Very good question, Ishita, because this is what feminists of every hue are actually engaged in, not valorizing, but visualizing unpaid care work. As Naila has said, at the university level, she sees herself as in a role in her teaching, convincing, making clear to students who will carry on what is it that care work is about and how critical it is. Yes, so each of, from what Naila said, what I take home is that each of us has to actually be good at what we are doing, feminists in what we are doing at present, and who we are influencing, are we able to influence? That's what we should focus on. Every little matters, and we have to start visualizing care work and not valorizing it. And that is clapping when, for essential workers, yes, and not actually compensating them. Considering the really awful work of low-caste women in artisanal fishing as environmentally terribly friendly, and the call of the day, but not actually rewarding it or not investing in them. So just quite a few things before we end about pulling everything together. Naila, thank you so very much. Like a forensic analysis of how inequality is growing, and that is at the bottom of our problem. But what I really, really struck me, and this is was towards the end where you talked about, and this is kind of dicey, that care of the effective kind, that is love, looking after children, etc., etc. These have to remain in the sphere of the voluntary. Everything else can be outsourced, as you said. Now, this is dicey because often this is, kind of borders between obligation and voluntariness, and, kind of the interpretation of the two, and the norms that construct these two areas, the obligation and actual voluntariness. But your linking to reproductive rights as an example was brilliant. Thank you very much for that insight. And I hope the people who worked on reproductive rights in our student group in the KIT course have taken this on board. Similarly, I hope that they have also all of it taken on board, and especially the rights group, how care has been codified as an obligation in what Lina said, and in this region. Codified both because of the personal, religious personal laws, family laws, but also as a concept in the civic laws, where it's the male income earner, and at the women's work is seen as complementary. So thank you for that insight, Yashodhara. There were so many insights in your paper, and the connection to which, to the present political economy of India, and the elitist politics, where caste and class matter, and nothing else, and in fact is attained by the empowerment of upper castes and upper classes, to the detriment of those who actually have and are still doing the care work. This comes hand in hand with the investments in healthcare, and the total shambles that public health in India has become, relying entirely on exploiting the so-called voluntary labor and of women. Thank you also for the insight that if we actually started treating them as skilled workers, even the GNP would look up, the growth, India's growth would look up, because their work would then have to be counted in the economy. Thanks very much. Okay, everybody, I hope that those of you, kind of who were listeners, have picked up on different aspects of the dimensions of work and care in pandemic times. And thank you for being here, and we look forward to a continued discussion. Thank you.
Thank you, everybody.
Yes,
Bye.
I will hand over to Lina.
Yeah, I just want to say thank you all. Naila, Yashodhara, and Maitrayee, thank you so much. And basically, this conversation doesn't end here. This is part of what we do to visibilize care. So
yes. Okay,
there will be a follow-up. So thank you all so much. Thank you, Maitrayee. Thank you.
Okay. Bye-bye, everybody.
Bye-bye.
Bye.
Bye.